Hello everyone, my name is Samuel and I am one of the summer students for Sinai Foundation Canada. In this video I will be delivering an informative presentation regarding first aid and CPR. As a disclaimer, the information that will be in this video does not replace formal first aid and CPR training. Always seek a medical professional if you are unsure of how to perform first-hand care for an individual. This video will summarize key elements covered within our new booklet on emergency care related topics in order to inform and educate individuals and also to direct them in emergency situations. When should you call 911? Emergency service should only be called when an immediate action is required regarding a life-threatening situation. This might involve a situation regarding a fire that is not contained or someone experiencing difficulty in breathing. First aid is basically emergency care-related attention that is usually administered immediately after the injury occurs and at the location where it occurred. And CPR stands for cardiopulmonary resuscitation. From this point on, I will be discussing emergency-related situations where first aid and CPR might be required. Here on the slide, you can see some of the signs individuals experience when having a heart attack. But what should you do when waiting for an ambulance? Give the person an aspirin unless they are allergic to aspirin or have been told by their doctor never to take aspirin, and begin CPR if the person is unconscious. Some of the signs individuals experience when having a stroke are mentioned here on this slide. However, when waiting for an ambulance, you should talk to the person experiencing the stroke and keep trying the conversation, or encourage the person to lie down, or perform CPR if needed. Seizures also have signs that can indicate that an individual is experiencing one. So what should you do while waiting for an ambulance? Try keeping hard or sharp objects away from the person. Check and keep an eye that their airway is clear, and look and watch at the start of the seizure to time its length. A heatstroke occurs when the body's temperature rises rapidly. The sweating mechanism fails and the body is unable to cool down. What should you do when someone you know is having a heatstroke at home or when waiting for an ambulance? It's good to provide a bath of cold or ice water that has been proven to be the most effective way of quickly lowering the core body temperature. And at the same time, you can consider pack them with ice and cooling blankets. As the dangers of possible spinal injuries are discussed on this slide, here are things that you can do when waiting for an ambulance. For neck injuries, loosen tight clothing and place heavy towels or roll sheets on both sides of the neck, or hold the head and neck to prevent movement. For head injuries, keep the person still, watch for changes in breathing and alertness, and perform CPR if necessary. There are different types of burns. Some are not that serious, like first degree, and some are extremely serious, like third degree. But how should you treat these burns? You can hold the burn area under cool, not cold, running water, or apply a cool, wet compress until the pain eases. You can also remove rings or other tight items and apply any beneficial lotion. The main way to treat a bee sting is to apply hydrocortisone cream, but to know whether or not if it's a bee sting, look for instant sharp burning pain at the sting site, a red welt at the sting area, and slight swelling around the sting area. Anaphylaxis can occur due to an exposure to something you are allergic to. You can treat it by using an EpiPen. You can also use basically epinephrine or adrenaline to reduce the body's allergic response if it's available. And you can also use intravenous antihistamines and cortisone to reduce inflammation of the air passage and improve breathing if it's available. If you see someone choking, the most common form of care is the Heimlich maneuver. Continue providing care until the object comes out or the person begins to breathe or cough. If the person becomes unresponsive and unconscious, call 911 and begin CPR, starting with chest compressions. Please keep in mind that there are courses offered at the Canadian Red Cross to help individuals develop vital life-saving knowledge and skills that are essential for those looking to meet a variety of workplace requirements. There is also pet first aid that individuals can educate themselves on. The content is developed by different Red Cross teams of scientific and medical experts. Finally, it is also very important to check for the Workplace Hazard Materials Information System with the Global Harmonized System of Classification and Labeling of Chemicals. If you would like to learn more about first aid and CPR, we have created a free educational booklet for you to access. To find out more, you can visit our website sinaifoundation.ca. Thanks for your time.